Okay, I'm Jenny Hilderman. I'm going to be continuing on with our IV demonstration. I'm going to be adding an IV piggyback for a second medication. All right, I'm going to head into my patient's room, perform high-end hygiene. I'm going to make sure I am following the 6 rights of medication. I have my right patient. Ivy, can you give me your name and birth date as I scan your bracelet? And that matches up. Okay, Ivy, it is 10:30 and we're going to be adding your antibiotic to your piggyback, as a piggyback IV med. Do you have any questions on that? All right, so I'm going to confirm the dose, the medicine, and the route in my MAR with my doctor's orders. All right, in the MAR we have that we are to administer clariforin 560 milligrams IV piggyback every 8 hours. And we're going to place that in a 50 milliliter sodium chloride bag using the IV piggyback. So that is going to, with a drop factor of 10, that is going to give us 70 milliliters an hour at 12 drops per minute. One thing I did note in the MAR is that our patient had a allergy to penicillin, so this could be a possible hypersensitive drug that we will need to watch for reactions with. And doctor is aware of that, and we're going to continue on. Okay, so now that I've confirmed the MAR, verifying the patient, the med, dose, route, and time, and at the bedside I've checked the patient's 2 identifiers, and we are going to go ahead and get this started. I'm going to perform hand hygiene again, and we are going to be adding from our medication vial our antibiotic into our piggyback saline. I can open it the easier way. Alright, I've taken my lid off of my medication. Going to clean the top of it with an alcohol swab. Dispose of that. I'm going to draw up 3 milliliters of air. Inject the air. I'm going to draw up my 3 milliliters of medication. And I'm going to alcohol swab my piggyback. I'm going to go ahead and inject the medicine into the bag. Oh, that didn't tap. And I did pre-check the bag to make sure that the expiration date was August of 21 and there was no discoloration. I'm going to put that in my sharps container. And then I'm going to need to get my tubing attached and ready. I'm going to make sure to hang my IV piggyback higher than my saline that I started with, my regular infusion. Going to go ahead and get this clamp closed. I'm going to get another alcohol ready. Not going going to touch the spike to anything but into the bag. And again, I'm going to hang, we don't have the best IV pole, but my IV piggyback higher than open my clamp to make sure I have no air in here. And going to use the tubing that's directly above the roller clamp, and I'm going to clamp off my main tubing. Checking on the patient's site, make sure we have no redness, infiltration. I'm going to clean the top of this with my alcohol swab and attach. And again, I'm going to calculate that we're going to have the piggyback be flowing at 12 drops per minute. So at 15 seconds to time it, I will be at 3. Okay, that is going. I'm going to go back and double check Ivy, how are we doing? Ivy's doing great. I'm going to perform some hand hygiene, and I'm going to continue to check on Ivy throughout this. Okay. After my piggyback is done, I'm going to go ahead and clamp this off. Take the tubing off. We're going to dispose of all of that. We're going to open this back up, and this again was at our, we need to return this to its original height if we would have moved it. And then we're going to adjust this back to 28 drops per minute, where we had left it at. Patient is not having any reaction, no hypersensitivity to this antibiotic. Her site looks good. And I'm going to leave her with her collate, bed down in comfortable position, and resume to check on her site and how she's doing. I'm going to document all of this in the MAR. So we're going to document that we gave the Clariform I also had labeled my antibiotic med with the med, the base solution, the time added by me, the nurse, the flow rate, and again my initials. That would have been on the bag of antibiotics so that myself and other nurses could double check and verify if there was any question. So, and then at this point, part of the documentation, I'm going to document in the MAR that at 10:30 we started and gave the antibiotic, infused it, and when it was done, removed it. Site looked good, patient reacted well, no hypersensitivity noted, and patient is relaxing.